Yoxly helps individuals date safely and with more confidence by providing a convenient, at-home sexual health testing service. In the age of modern dating, the stigma surrounding STIs is breaking down. But people aren't getting tested or treated because they're struggling to access sexual health services. To put this into context, STIs are on the rise, with 470,000 new diagnoses in England last year. But with £700 million in public health budget cuts, gum clinics are closing across the nation in the face of rising demand. Remaining clinics are more than 500% oversubscribed. For example, in just 1 month, one clinic turned away over 1,000 people, over half of whom were symptomatic. To combat this growing problem, Yoxly offers convenient and confidential sexual health services. Users register on our site and purchase our test kits, which are discreet and arrive the next day. They take the test at a time that's convenient for them and post their samples back to our lab. Within 2 to 4 business days, users are emailed the results, along with guidance about treatment, retesting, and anonymous contact tracing. Our solution works because it gives people what they want: convenience, privacy, accessibility, and control. The UK spends more than £360 million annually on STI testing and treatment. Last year, the NHS performed 1.8 million STI tests. But that number doesn't include private testing options or reflect unmet demand. Most importantly, it doesn't account for the discrepancy between how often people should be tested versus how often they are tested. There are 18 million single adults in England. If half of them are sexually active and follow best medical practice, collectively they would need over 13 million STI tests each year. And that's just England. Even when extrapolating conservatively, North American and European markets are considerably larger. 3 independent studies predict that the global STI diagnostics market will reach £100 billion by 2025, with a compound annual growth rate of nearly 9% over the next 3 years. Our research shows that 76% of people have had an STI test. 85% are willing to pay for an at-home sexual health test. And while 73% want a record of the results, almost nobody has easy access to them. In the UK, there are publicly and privately funded STI testing options, all with ample room for improvement. Yoxly provides a more accessible service, not limited by postcode, test type, or kit quantity. We adopt a friendlier approach, not overly clinical or alarmist. Yoxly affords users more control over their tests and their results, giving them a digital health record that can be shared with prospective partners, empowering them to shape their dating conversation. We began as a B2C business with a pay-as-you-go model, but soon we found people wanted a subscription-based service. So, we offer 4 STI test packages, ranging in price from £40 to £200, with an average gross margin of 44%. Yoxly is exploring B2B2C channels and looking to partner with dating apps, whereby users could verify their enrollment with Yoxly and demonstrate their commitment to sexual health. Imagine a world where Yoxly changes the conversation so much that it becomes normal for prospective partners, when sat in a bar, not only to discuss their sexual health, but to show evidence of regular STI testing before taking things further. Yoxly is obsessed with its consumers. More tests means lower lab prices, which translates into savings for the customer, market expansion, and further consumer obsession. But Yoxly isn't just a testing company. At-home tests are our first step in becoming the one-stop shop for all matters related to sexual health. This includes a digital records platform, an online pharmacy, and additional diagnostics. For a small ancillary fee, users will soon be able to add a COVID test to any Yoxly package. People were struggling to get into gum clinics before COVID hit. Now, it's nearly impossible. The pandemic has highlighted the significance of public health, the need for better education, the importance of early detection, and the prompt treatment of disease. Remote medicine is the future of healthcare. COVID has accelerated that trend. and Yoxly will be at the forefront of that transition. We've overcome some significant barriers to entering the medical marketplace, and we start trading this week. In Q4, we're focusing on establishing an online presence, gaining traction, and exploring partnerships. In 2021, we'll be looking to secure additional funding to develop an app, expand our range of tests, and open an online pharmacy. So, this is all very promising. But Yoxly is about something bigger. We've seen the normalization and destigmatization of mental health over the last few years. It's taken center stage in headlines, at workplaces, and around dinner tables. Yoxly will do the same for sexual health. The LGBTQ community is already at the forefront of introducing sexual health into daily conversation. Yoxly wants to expand that discussion beyond the queer community and into society at large. We're on a mission to dispel the preconceived notions surrounding sexual health, making it approachable, in vogue, and ubiquitous. In the same way that smoking has become socially unacceptable, so will not having an STI check. It is our vision to elevate STI awareness and testing into a societal norm. It's simple, it's sexy, it's just expected. So yes, we want to provide a practical service, but there's something bigger at stake. We want to involve everyone in a conversation once deemed taboo, but which is now on the cusp of a movement. To that end, our team numbers 3. But we aren't just co-founders. We are activists. I'm Denai. I'm a doctor with a background in public health. I've led other medtech startups. I've worked in healthcare for 18 years on 4 different continents, and I believe we can do better. There's Jason. He's a chemical physicist and research scientist. He's led tech teams across Europe and North America, and he's won international entrepreneurship awards. There's Judson. He's a military historian turned businessman with experience in operations and marketing, and he's helped shape the queer scene for more than a decade. And then there's Ben. With him as our advisor, we form a diverse and capable team that can execute our vision. Together, we are Yoxly. We're a movement that's breaking down barriers and making room for change, and we invite you to take part on that journey with us.